I'm very grateful to present this video abstract of our article titled Efficacy of a Self-Designed Questionnaire for Community Screening of COPD. Chronic obstructive pulmonary disease is a common preventable and treatable disease that is characterized by persistent respiratory symptoms and airflow limitation. The overall prevalence of spirometry-defined COPD among the general Chinese population aged over 20, 40, and 60 years with 8.6%, 13.7%, and 27% respectively. However, there remains a deficit in screening. Patients with mild airflow limitation usually have no symptoms. Because community medical resources in China are relatively undeveloped, the cost of spirometry screening is high, and trained operators are limited. There is underdiagnosis of COPD. Thus, screening questionnaires have been recommended, but many of these questionnaires do not focus on symptoms but rely on risk factors, and some questionnaires spend too long screening times. In addition, the influence of gender on cutoff values has not been considered. Therefore, a simple screening questionnaire based on the COPD population screener and the COPD screening questionnaire, including only 5 items, named the COPD-Minhang, was developed. It focused mainly on symptoms. Each item of the questionnaire is set the same answer for convenience, and the maximum score for each question is 4, with the highest total score of 20 points. From November 2019 to August 2020, the screening was conducted among residents over 40 years of age in Minhang District, Shanghai. 1,023 participants were included in analysis, with a detected prevalence of 12.4% for COPD. The best cutoff values for the COPD-PS, COPD-SQ, and COPD-MH were 4, 16, and 7 points respectively. The Roc Curve Analysis in terms of the identification of COPD by the 3 questionnaires were not significant, suggesting comparable predictive validity of them. Gender had an effect on the cutoff values for the 3 questionnaires, and the self-designed COPD-MH had higher diagnostic efficiency and sensitivity with gender-specific cutoff values for both males and females. In conclusion, COPD-MH is comparable to and less time-consuming than the existing screening methods for COPD. The best cutoff values for men and women differ between all 3 COPD screening questionnaires.